Hi everyone, welcome to another one of our 12 Days of Wellness segments here at Ogden Clinic. Today I am joined by Dr. Mary Ellen Mason here at our Professional Center North location. So tell us a little bit more about what you do here.
Well, I'm a family medicine physician practicing here. I was in Farmington until August and then up to PCN to kind of help out here and build my practice here.
So today we're talking all about preventative medicine, screenings, blood work, all that stuff that we kind of tend to forget throughout the year. So our segment today is going to be all about how to prepare to do all that in the new year and the importance of it. So why is preventative medicine so important?
Well, as they say, an ounce of prevention is worth a pound of cure. And so if we're able to recognize that people may have some risk factors that might put them at risk for diabetes or heart disease, and we can do that with some of our screening labs, then we can start treatment until, to prevent perhaps a worsening condition or an event.
Awesome. So what are some of those screenings that you find that people tend to forget more often that are actually really important and we shouldn't be forgetting?
So definitely would like people, especially if they have any family history or maybe carry a few extra pounds, to think about getting screened for diabetes. You can do that simply with a blood test that measures what's called a hemoglobin A1C.
What about for like women and men? What are some screenings that, you see that they might tend to forget?
Yeah, so for women, of course, we like to do cervical cancer screening for women, starting usually in their early to mid-20s. They can be done every 3 to 5 years. For men, just mostly the lipid and the hemoglobin A1C, but also just have them come in annually to review their immunizations, and blood pressure readings can be helpful.
And another question that people tend to have is in terms of blood work. I think that's one that we don't really know when you should do it, or do you only do it when you come in and they request it? But is blood work something that we can do every year or every so often to just keep tab on our health?
Yeah, definitely. And I think as you start to get a little bit older, it might be wise to have that done every year, at least to check the hemoglobin A1C and the lipid panel. And that can be really beneficial to catch people that might be at risk for heart disease or stroke or diabetes.
And for people that may not know, what are some other things that blood work can test? Why would it be beneficial to get your blood work done?
Typical screening labs that I order for patients at an annual visit would include a blood count, a metapoly panel that checks their kidney and liver and their electrolytes, thyroid, and then the lipid panel and the hemoglobin.
So it's a really busy time of year. Obviously, we're getting ready for the holidays, buying presents. We tend to kind of neglect our health. What are some tips and recommendations that you would have for people in terms of remembering or facilitating how to schedule all of these screenings that they might have forgotten?
Yeah, I mean, maybe make it your New Year's resolution and kind of make it, pick a month that you're going to have those screenings done, and maybe it's the same month that you also get your teeth cleaned, or, take your pet to the vet for their wellness check. Just make it an overall family wellness month.
Awesome. I love that recommendation. It's always easier when you make it part of your day versus just making it a tedious task. Like, we all tend to look at it sometimes. Is there anything else you feel like you want to add, or any more recommendations for the people watching today?
Doing the preventive exams is one of my favorite parts of my job. And usually we schedule a little bit of a longer visit so we can really kind of get down into the nitty-gritty and get to know one another a little bit better. So I really enjoy them.
Awesome. And building a relationship with your provider is probably one of the best things you can do in terms of your health as well. So this is a holiday segment, so I do have a holiday-related question for you. What's on your Christmas wish list for this upcoming Christmas?
I really hope that we can get through this severe respiratory illness season without having too many more folks coming down with respiratory illnesses. So hopefully everybody's staying healthy and safe.
I love that. Well, thank you so much, Dr. Mason. We're really happy that you're able to talk to us today and give us some more tips and recommendations on how to start 2023 off to a healthy start. So thank you.
Yeah, thank you.